Welcome to Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Doreen Wu, a clinical assistant at Bass Plastic Surgery in New York City. I'm excited to be here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The title of today's episode is Ozempic Face. Okay, this time I've heard part of the title, but I'm not sure I understand the wheres and hows of Ozempic Face. I'm not intimately familiar with all of the details. Can you start me off with some background?
Before we get to the face itself, let's talk a little about Ozempic, what it's used for and how it works. This medication is one of a few medications in use which are something called glucagon-like peptides. These have multiple metabolic effects, including stimulating secretion of insulin, delaying gastric emptying, and inhibiting appetite. The medications are used to treat people with type 2 diabetes as a weekly injection performed at home. These effects also work to limit caloric intake and showed significant weight loss in these patients.
What kind of weight loss are we talking about?
Typically 15%, with some of the newer options, even 20% of body weight. So that means if you weigh 200 pounds, you could slim down to 160 pounds over a typical 6-month course on the medicines. And picture what you would have to do with diet and exercise alone to lose 40 pounds in 6 months.
That sounds like a dream come true for so many Americans. So what's the catch?
Well, there are some side effects like mild nausea, which often clears after a few weeks on the medicine. But remember, the main use up until now is to help diabetics control their glucose.
That doesn't sound too bad so far. Anything else I should be aware of?
Well, there are a couple of other things. There's some rebound back towards your starting weight, and that's where the real mischief starts. Current studies differ on how much rebound and how fast it occurs. So I think we'll have to wait and see what the data shows when larger number of patients are using the medication just to facilitate weight loss and not trying to treat diabetes. The diabetic patients tend to continue on the medication or something similar, so they haven't really given us enough data to understand this clearly. People going on a course of weight loss medication and then coming off it are really the group of patients that's going to answer that question for us. In any event, as the patients lose weight, skin can be looser as well, and that's the big issue. And we see this with every form of weight loss. It's not specific to Ozempic, but with dieting, with massive weight loss after bariatric surgery, procedures like gastric banding and gastric bypass. The large change in fat volume in the body produces skin laxity in many areas. After bariatric surgery, patients often need skin tailoring in areas like the thighs, buttocks, waist, and arms, just to name a few.
Yes, so I've heard that, but this episode is called Ozempic Face. What happens to the face?
The face is an area that's very sensitive to weight loss. We love losing weight because it helps us fit into our clothes and gives us the body shape we want, but it hurts us in the face, especially the aging face. We start losing volume in the face in our mid to late 20s, and we continue to lose volume as we age, but this starts to be at a tipping point where it really hurts us in our 40s and beyond. If weight loss is overlaid on this aging volume loss and accumulation of skin laxity, the effect is further amplified. For some individuals, they'll be, especially if they have obvious visible skin laxity to start with, that will be worsened, or they'll reach a tipping point where they start to show visible skin laxity where they weren't quite there before. So in this way, Ozempic Face is really no different than what can happen to anyone with significant weight loss that occurs by any means. Diet, exercise, bariatric surgery, it really doesn't matter. It's about the amount of weight loss, the degree of pre-existing laxity, and maybe to a lesser extent, the rate of weight loss. It's not the medicine itself causing it, it's the weight loss causing it. So unfortunately, this is an example of where you have to take the bad with the good.
What have plastic surgeons been seeing with patients on these glucagon-like peptides like Ozempic?
A range of skin laxity problems in the face and neck. Of course, this doesn't happen in every patient. It's more likely in older patients or patients with pre-existing laxity. For some patients, the effects are enough to notice, but they're still mild. Other patients actually show pronounced volume loss with obvious hanging skin in the neck, a turkey waddle or something like that.
That sounds unfortunate. What can be done to counteract these unwanted effects?
So plastic surgeons actually have a lot of experience dealing with facial volume loss, both in chasing aging changes and in treating patients who are treated with certain kinds of medications that cause lipoatrophy. So typically, this is done with injectable fillers to restore shape and fullness in areas that have flattened or hollowed out. It's not clear if fat grafting would be a worthwhile approach because the fat grafts themselves could undergo further degradation if you continue the medication. We see that when we fat graft the face and someone gains weight, their face gets heavier. And when they lose weight, they lose some of the volume of the fat graft. So that may not be a good approach. Some patients actually need lifting procedures, and face areas usually are going to respond pretty well to fillers, but in the neck, if we really are at the point where there's hanging skin, that's going to mean surgery.
Lastly, Dr. Bass, can you give our listeners some parting takeaways?
Well, the health benefits of good glucose control and weight loss are so important they eclipse the limitations of possible volume loss and laxity in the face. As I said, there are other medicines like antiretrovirals which have lipoatrophy as a direct effect of the medication, which doctors have been treating with FDA-approved therapies for almost 2 decades. So this is something we know how to do. The incidence is unclear, but there's some risk of effects like this with medicines like Ozempic. Again, I think it depends on how much pre-existing laxity, how much weight loss is involved. The effect can be mild or more severe. So facial areas are usually going to respond to injectable fillers, and that's going to correct contour changes. Mild laxity along the jawline or neck is going to respond to energy treatments, or some have suggested treatments like Elevate. But if there's significant hanging skin under the jawline and chin, then face and neck lift surgery are occasionally needed. The final point that I think is important because of that issue of rebound, just like when you go off a diet, weight sometimes rebounds. If you're discontinuing the medication, wait to judge the rebound effects before undertaking a surgical procedure. But treatments like fillers might be a good temporary fix for facial issues, even if you do rebound to some extent on the weight loss.
Thank you, Dr. Bass, for sharing your insight and shedding light on this very hot topic. Thank you for listening to the Park Avenue Plastic Surgery Class podcast. Follow us on Apple Podcasts, write a review, and share the show with your friends. Be sure to join us next time to avoid missing all the great content that's coming your way. If you want to contact us with comments or questions, we'd love to hear from you. Send us an email at podcast@drbass.net or DM us on Instagram @drbassnyc.